Wegovy's American list price, $1,349 a month. The cash price on Novo Nordisk's own website, $349. Same company, same pin. $1,000 apart in almost everything you've heard about why is a myth. 4 myths, 5 minutes, including the one Washington changed this very month. Both of those numbers sit on the maker's own pricing pages right now in July 2026. Every figure here is public data, sources on screen and linked below. Where a number is an estimate or still moving, we'll say so. Myth 1. It costs that much to make. Not according to the research or the makers themselves. Peer-reviewed estimates say semaglutide, the molecule in Wegovy, could be made and sold at a profit for a few dollars a month. And watch what the companies do when they sell direct. Since November 2025, Novo sells Wegovy to cash-paying Americans for $349. New patients start at $199. Lilly matches it with Zepbound vials, $299 to $449 since December. Same medicine, roughly a quarter of list. Wherever the true floor is, the list price isn't it. You're paying for the system, not the chemistry. Myth 2. Other countries get a weaker version. They don't. Wegovy is the same semaglutide pen, same brand, worldwide. One naming wrinkle? Abroad? Zepbound's molecule sells as Mounjaro, and Ozempic is the same semaglutide sold for diabetes. Different labels, same medicines. In Germany, the maintenance dose reportedly runs about €277 a month, after the maker cut prices there in April 2025. Patients pay cash. In Britain, the list price set in 2023 still runs about £73 to £176, and the narrow group covered by the health service pays a £10 prescription charge. Even in Denmark, the company's home country, the register price is about $340 a month, out of pocket. Back in 2023, health researchers put America's list price at roughly 4 times Germany's for the exact same pen. Those countries negotiate one national price. America's list is what happens when nobody does. Before the myth Washington just rewrote, we built a free, plain English checklist for exactly this. Every legitimate way to pay less, and what to ask before you trust any price. It's linked below. Myth 3. Insurance covers these now. Sometimes, and the fine print is doing heavy lifting. In 2025, fewer than half of America's biggest employers covered these drugs for weight loss. Only 13 state Medicaid programs still do, and 4 states dropped coverage just this year. Then on July 1st, 2026, this month, Medicare began covering weight loss use for the first time, a $50 copay under a temporary pilot that runs through the end of 2027. Real relief, but a pilot, not a promise. The headline Medicare negotiated prices, $385 a month for Wegovy, don't start until January 2027. Meanwhile, by late 2025, 1 in 8 American adults was on one of these drugs, and more than half of users said they're hard to afford. Picture a 58-year-old school aide in San Antonio. Her plan doesn't cover weight loss drugs, and she's years from Medicare. The maker's own discount price, $349 a month, is still about $4,200 a year out of pocket for the discount. Myth 4. So just get it from abroad or compounded. That's where the honest asterisks live. U.S. law doesn't actually give you the right to import these drugs. Regulators typically look the other way for up to a 90-day personal supply. But because Wegovy and Zepbound are approved here, even that gray zone isn't guaranteed, and mailed packages can be seized. The cheap compounded semaglutide era ended in spring 2025 when the shortage was declared over and the copying deadlines passed. And the counterfeit problem isn't a dark web story. Fake semaglutide pens have turned up inside the regulated supply chains of the United States, Britain, and Brazil. Over 1,100 adverse event reports tied to unapproved versions by 2025. A cheaper pen is only a bargain if it's real, legal, and safe. And that's 3 separate bets. So here's the picture, both sides on the table. The gap is real. Americans spent nearly $72 billion on this drug class in 2023 alone, before rebates. But prices are bending fast. The maker's cash price fell to $349 in November. The list itself drops by half to $675 on January 1st, 2027. The same day Medicare's negotiated prices land. A White House deal reportedly pushes starting doses to around $350, though the fine print isn't public. And in April 2026, Canada became the first G7 country with generic semaglutide, partly because the maker missed a $250 patent fee back in 2019. The honest move isn't ordering mystery pens, and it isn't paying list price on autopilot. It's knowing every legitimate channel before you pay, and that's a conversation for you and a licensed prescriber, not a website. If a no-hype breakdown like this is useful, subscribe. The real cost of care. No clinic ads. $13.49 on the list, $3.49 on their own site. Same company, that gap is the system, on full display. You shouldn't have to go broke to feel whole.